Good day, ma'am. I am Sheila Marie de la Cruz from BSN 2B. For today's return demonstration, I will be performing an immediate newborn care. So this is an early management of the newborn baby in the delivery or nursery room after or within a few minutes after birth. In this procedure, here are the materials that we will be using. The first tray is considered as the sterile equipment or articles. So it includes sterile gloves. I have 2 sterile gloves, bulk syringe, sterile gauze, scissors, and 2 forceps, betadine, and cord clamp. So this is the non-sterile equipment or non-sterile articles. It includes digital thermometer, ID band, tape measure, eye ointment, cotton balls with alcohol, 1 ml of vitamin K, 1 ml of Hepatitis B vaccine, and 1 ml of Bcg Vaccine. Also, I have here catheter. We will also be using stethoscope. And this is the blanket for the newborn baby. This will serve as my weighing scale with towel. And lastly, the health record of the baby with the information of the mother as well. So, before the procedure, here are the things that we need to follow and consider. First is to wear the prescribed gowns, mask, and cap. Also, we need to follow aseptic techniques at all times. We can also provide privacy and comfort to the patient. And lastly, we need to perform hand hygiene or hand washing. Wash hands and wear double sterile gloves. This is done to prevent the spread of infections or microorganisms. This is also done to protect the nurse and the baby from contamination or infections. Dry the baby's skin immediately. Using sterile gauze, wipe the baby's mouth and nose. Wipe also the back by rubbing and the other parts of the body. Be careful not to remove the vernix caseosa and do tactile stimulation of the soles of the feet. This is done to prevent loss of heat by evaporation and to stimulate the baby to cry. Then, cover the baby with a warm blanket. This is done to prevent hypothermia on the newborn baby. Then after that, carefully perform an assessment of the newborn using the Apgar scoring tool. Assess the appearance, pulse or heart rate, grimace, activity, and the reflex irritability of the newborn. Apgar scoring tool will help to determine the general condition of the newborn within first minute of life. Promote skin-to-skin contact between the mother and the newborn. Place the newborn directly in the prone position on mother's chest or abdomen. Cover the newborn with a dry towel or blanket and cover the head with a closed cap or bonnet. After that, after 5 minutes, reassess the newborn using the Apgar scoring tool and from head to toe assessment. This is done to evaluate the condition of the newborn within 5 minutes of life after birth. Also, this will help us to determine whether the baby is able to live outside the uterus of the mother. Remove the soiled outer pair of gloves. This is done to prevent contamination. Discard it in a proper receptacle. Allow at least 3 minutes after the delivery to cut the cord until the cord stops pulsating. This is to allow more blood from the placenta to transfer to the body. First, Clamp the cord with a curved forceps with latex band or with umbilical clamp 2 cm away from the base of the cord. Then, apply straight forceps 3 cm away from the first clamp. Then, cut the cord and slide the latex band carefully and gently towards the base of the cord or clamp it using the umbilical cord clamp. After clamping or tying the cord, check the presence of the following: 1 umbilical vein and 2 umbilical arteries or the AVA, and check for the presence of bleeding near the base of the cord. Promote early breastfeeding. Observe for presence of rooting and sucking reflex and initiate feeding. Clean the nipple with a clean cloth or gauze from inner to outside direction and introduce the mouth of the baby to the mother's nipple. Now administer the Credis prophylaxis. First is open the newborn's one eye by gently holding the upper lid upward with index finger and the lower lid downward with the thumb. Squeeze the eye ointment gently and deposit 1 cm of medication off the lower lid. Apply the ointment from the inner to outer canthus of the eye. Do the same thing to the other eye. Now, for the ID band, place the ID band with the complete name of the mother and the baby, preferably on the ankle of the newborn. Line a table with a towel and place the newborn. This is done to prevent heat loss from the newborn's body. Now, with the use of tape measure, measure the length from crown of the head to the sole of the foot. Then measure also the head circumference and the chest circumference. This is done to determine if the intrauterine growth is within normal. Also check the temperature. This is done to assess the baseline temperature and to determine further loss of the body heat. Now, insert a small catheter tube into the anus to check the patency of the anus. The catheter used is 8 French. Line the weighing scale with a towel and check the weight. The towel will help to prevent the loss of heat from the newborn. Then prepare to inject the vitamin K, Hepatitis B, and Bcg vaccines. The vitamin K is injected at the vastus lateralis muscle in intramuscular injection. This is done to prevent hemorrhage that may lead to anemia of the baby. Before injecting, wipe the thigh using a cotton balls with alcohol. Next is the Hepatitis B vaccine. This is also injected in the vastus lateralis in intramuscular, but this is injected on the other thigh of the newborn. The last vaccine that needed to be injected to the newborn is the Bcg vaccine. This is injected in the upper arm and through intradermal injection. You can also do footprinting of the newborn's feet on the indicated newborn's record. Then perform aftercare of the materials and equipment. Provide gentle, minimal handling and watchful eyes to promote mother and child bonding. Promote rooming in and breastfeeding. Bring the baby to the mother. Be sure to check the baby's identification with the mother. Give instructions to the mother regarding breastfeeding and care of the baby. To promote and support RA 7600, Rooming in and Breastfeeding Act of 1992 for maternal and child health. After that, remove your gloves and perform hand hygiene. For the documentation and evaluation steps, record the assessment result of the 1 minute and 5 minutes APGAR score. Also note if there are presence or absence of respiratory distress, and if the newborn is free of infection and other complications. Also, document that the baby is defined correctly with complete and correct data. Also, recording of the dose, route, and time that the vitamin K ophthalmic ointment, Bcg vaccine, and Hepatitis B vaccine is administered. Lastly, recording of vital signs and anthropometric measurements. That's it for the immediate newborn care. Thank you for watching.